When managing the airway of an unresponsive patient without a gag reflex, oral pharyngeal airways are always a good choice. As always, be certain to wear appropriate body substance isolation when managing a patient's airway, and begin with manual airway maneuver first, such as a head tilt, chin lift, or a jaw thrust for those with suspected spinal injury. Oral airways always come in a multitude of sizes, so the first step to using one is to determine the correct size for your patient. The way to determine the appropriate sized oral airway for an adult patient is to measure the airway against the side of the patient's head. The oral airway should always extend from the corner of the patient's lips to the bottom of the earlobe, or the angle of the jaw. Once the correct oral airway is selected, open the patient's mouth using a cross finger or scissor finger technique. The airway is then inserted into the patient's mouth with the tip pointing forward to the roof of the mouth. Once the airway touches the soft palate, rotate the airway 180 degrees into the anatomical position with the flange resting against the lips or the teeth. Once the oral airway is inserted, check the adequate air exchange.
Okay, just count it.
There was a SpongeBob episode where he kept on putting his hand.